Welcome everyone to the AIHM Friday Wellness Webinar. We're going to let everyone join the meeting. Take a few minutes while that's happening. People are coming in from Facebook and into the Zoom room. So welcome. And I'm just thrilled today. We're going to be having a wonderful presentation on integrative medicine in medical education, culture, and society. And with us are Dr. Rashmi Mullur, Saloni Gupta, and Tanya Datta, and we're just really thrilled to have them. So while everyone's coming in, for those of you who are joining us from the first time, the Academy of Integrative Health and Medicine is a global interprofessional integrative health association working to transform healthcare, body, mind, spirit, community, and planet. And we began in the 1970s and now are the Academy of Integrative Health and Medicine. And we're just really so glad to have you here. If you have not yet subscribed to our YouTube channel, please do that, youtube.com/AIHM Global. And all of our wellness webinars are live streamed and then saved to the YouTube channel. So if you're not able to attend today, or if you have to leave early, you can always go and get rewatch the webinars and share them with your friends. So I would really love to welcome our special guest, Dr. Rashmi Mullur. Rashmi is an education lead for integrative medicine at UCLA. She's an endocrinologist pioneering clinical pathways to incorporate integrative techniques. She's dedicated to advancing the clinical practice of integrative health and medicine and increasing educational opportunities for students interested in these practices. And she'll be speaking at the upcoming AIHM conference in March, on March 27th, on telehealth and integrative medicine in the COVID era. So we hope if you like this, you'll join us to hear her again then. We also have with us Saloni Gupta. She is a second-year medical student on the Global Health Equity Pathway at the David Geffen School of Medicine at UCLA. She creates unique meditation classes previously for HIV patients as part of the Santa Cruz AIDS Project, and now for her medical school peers. She volunteers as a prevention educator in medically underserved areas in the US and India. And she was one of the winners of the AIHM Student Research Award ceremony this year for her incredible research. And Tanya Datta is also a second-year medical student at the David Geffen School of Medicine at UCLA. She worked at Massachusetts General Hospital researching the neuroscience of meditation and yoga through fMRI studies and saw firsthand how science and spirituality can coexist. She is passionate about creating spaces for her peers to find refuge in meditative and mind-body practices amidst the busyness of graduate student life. And she was also the co-winner with Saloni of the AIHM Student Research Awards in 2020. So I welcome all three of you here. We're just thrilled to have you and looking forward to your presentation.
Thank you so much, Tabby. We're so delighted to be here. Thank you for making this happen. We just wanted to start by introducing our group, DGSOM Meditation. So Saloni and I, along with our classmate Michael, founded DGSOM Meditation at our medical school in the fall of 2019. So we're a community of practice that meets every weekend to meditate together and learn about the different forms of meditation, including metta meditation or loving kindness, chakra meditations, vipassana meditations, mindfulness meditations. And we wanted to just create a space to create a deeper understanding of the mind-body connection for folks at our school and create a weekly structure that gives our peers and ourselves permission to set aside the studying for a moment and to practice together.
Absolutely, and we feel that our group has been really important, especially now during the COVID-19 pandemic, when a lot of our classmates have been socially isolated and classes are canceled, moved online, and we're not necessarily encouraged to travel home for breaks either and things like that. So people have really been feeling isolated, but we wanted to provide this group as a form of social connection, even just online. And a lot of our classmates have told us that it's helped them, feel connected to others during this time and, the loneliness of the pandemic. And I think one of the really big things is we strive for consistency. So we meet every week, every weekend, even during holidays and during breaks. And we really wanted this to be something that our classmates could rely on when, everything else is kind of up in the air right now. And apart from that, we've also maintained a group chat online, and in that we have all of our members and people can share tips about meditation or daily affirmations and things like that. And the amount of support we've seen in that group has just been incredible.
Definitely. I think what's really special about this group is a sense of vulnerability we don't often see in spaces in medical school. I think medical students often don't open up to one another, especially when there's too many of us in one room for the sake of appearing professional, whatever that means. And we tend to hide perceived weaknesses or faults. So it's been such a moving experience to see the ways and people have opened up in the past year and a half. And even now that we're on Zoom, though we can't see each other in person or hug each other, I still feel everyone's energy through the screen. So we like to say it's almost like telehealth in a way. So while
It is.
Yes. While we were building this community, we realized that there were actually so many more people at our school who had some sort of interest in meditation, but just couldn't find the time. Maybe they tried once or twice through an app, or they've started and stopped a lot of times. So we realized that there is this need, that there were a lot of people who are actually interested, but they needed the push and the accountability to actually do it, and importantly, on their own time and schedule. So that's how we came up with the 31-day meditation challenge. It honestly just started as a fun way to ride the New Year's resolution wave and pose this challenge to our class, but we were really blown away by the amount of support that we got. So for example, Dr. Mullur here brought up the challenge during her lecture on stress to the first year students and highlighted the benefits of meditation there. And because of support like that, we had 78 people sign up in our first year, including medical students from all 4 classes, leave of absence students, staff, faculty, and even a PGY1 resident. And thanks to Dr. Mullur's mentorship, thanks to the opportunities AIHM gave us, thank you Tavi and Jess for making this possible. We were able to present a poster at the AIHM conference last October on our results from our first 31-day challenge. And we would like to present that to you now.
Okay, so while Tanya shares our poster, we can just give a bit of a background. So when we were thinking about doing this challenge, we wanted to look at the literature about what already exists out there in terms of the benefits of meditation. And so, as I'm sure most of you, or if not all of you know, meditation is one form of a mindfulness practice. And mindfulness is really about paying attention to the present moment in a specific way with intention and no judgment and with curiosity. So really just forgetting about, past and future and paying attention to what's happening right now in a very specific way. And I'm sure a lot of you guys have heard of the Mindfulness-Based Stress Reduction Program, or MBSR, that was started in 1979, and it's a very formal kind of course that people can take. And it showed that mindfulness and meditation can be effective in the treatment of chronic pain, stress, depression, and anxiety, and sleep outcomes in patients that have chronic disease. Separately, mindfulness has also been studied among healthcare workers as a way to cope with stress and burnout, which we know are at all-time highs right now. And it showed there was a few studies about that, but data has been really limited on that, and a little bit inconclusive. And then we've also seen that a long-term meditation practice confers benefits for stress management. So that's what we've seen so far.
Exactly. And for that reason, we felt that creating a student-led, student-run community of practice would promote a long-term and sustainable interest in meditation. So we created this novel program, the 31-Day Meditation Challenge, that coupled peer support with meditation resources. And we were able to demonstrate a feasible and successful way to model integrative approaches to wellness for busy medical school students and staff at DGSOM.
Yeah, so in terms of logistics, so we asked people to sign up, and then as soon as we had our list of participants, we provided them with a variety of materials at the beginning of the program. So that included things like what are the purposes of meditation, some tips on meditating effectively, a list of resources like YouTube videos or apps that they could use during the course of the 31-day challenge. And we also gave them access to our weekly meditations on campus back when we did this in 2020 and then online in 2021. And those were through our group, DGSOM Meditation. And the instructions that we gave people were really, really simple. And that's, I think, what we really strived for is we didn't want to put extra stress on people's plate, but make this something really easy that they could do. So we just said, meditate once a day for 31 days. It can be any duration of time. It can be anywhere. And it can be at any time of day.
Exactly. And we were able to pair interested volunteers to be accountability buddies for each other for the duration of those 31 days based on experience level. And so partners were asked to update one another every single day regarding whether or not they had successfully completed their meditation goal for that day. So the idea was even if you weren't able to meditate one day, you would still update your partner and they would give you a little pep talk to get you through to the next day. And we also had participants fill out a pre-program survey, weekly surveys throughout the course, and a post-program survey as well. And so, like I was saying earlier, we had 78 volunteers at DGSOM participate, including 52 preclinical medical students, 12 medical students in their clinical years, 3 leave of absence students who usually pursue a research year or master's degree, 5 staff members, 1 postdoc, and 1 first-year resident physician at UCLA Health.
Absolutely. And before the program started, we did a pre-program survey and we wanted to know about people's experience level so we could tailor the program to them a little bit. So we found that most participants were beginners with little or no meditation experience. And then going into the program, they had an average confidence level of 7.34 on a scale from 1 to 10. And we also asked people, how many minutes do you think you might meditate every day? And the average for that was 8.36 minutes per day. So during the actual 31-day course, we wanted to see how much people actually did meditate. So we found that over the course of the 31 days, people on average meditated for 18.57 days. It's a little more than half. For an average of 9.51 minutes per day on the days that they actually did meditate. And if you look at everybody together, 10 people managed to meditate for all 31 days, which is fantastic. And then 43 people meditated for at least half the days. So also fantastic.
Yeah, and it was exciting how much people meditated during the challenge. And we also wanted to see whether that would carry on after the challenge. So we gauged long-term meditation interest afterwards. And out of the 67 respondents to the post-program survey, 51% stated that they were very likely or likely to continue a regular meditation practice after the program, and 59% stated they would be very likely or likely to repeat the challenge the following year.
And another really important thing for us to measure was the value of having an accountability partner, because we think that is something that was unique to this program. And so 60% of respondents said that they found their accountability partner very helpful or helpful throughout the process, which is great. And then 15 people actually said that they wanted to continue to have a partner throughout the rest of the academic year.
And beyond the 1 through 5 like heart scales, we also had an additional comment section in the survey, and there we found 11 respondents mentioned having improved sleep quality, 7 respondents mentioned a reduction in stress or anxiety, and 7 respondents mentioned increased feelings of calm, peace, or relaxation, which are very important qualities for often overburdened medical students and staff.
Absolutely. So, what we concluded from this is that this type of student led peer support meditation program, which has this component of having an accountability partner and a component of providing resources and providing a space to come together, we thought would be a really effective strategy in helping medical students and other people affiliated with medical schools, like faculty and staff, integrate mindfulness into their busy schedules in the long term.
Yeah, and we're also excited to share we just finished our second 31-day meditation challenge this year, and this time we had 105 people from UCLA and other medical schools on the West Coast. We wanted to take advantage of everyone being online this year and wanted to make sure that everyone who wanted to participate had an opportunity to do so. So we're excited to see what the results hold this year. So thank you so much for giving us a space to share this passion project with you all.
I am so impressed by this. Every time I hear it, it's impressive. And I think that what you both have created is really a wonderful group, not only for our medical students, but also now expanding forward and giving a toolbox for how other institutions can incorporate these practices. I think it's been a wonderful community of practice. I have certainly enjoyed the meditations, and certainly having that accountability partner has been key. It has been, as a participant this year, I can tell you it made such a difference. So I am super proud of you guys. Thank you for sharing this, and I will turn it over to Tabby.
Yeah, what a great model. I mean, truly, it's really incredible. And just to see the engagement and how, you all just really responded to how, we were all isolated and how do we deal with that, and created community that was just such a service. Thank you so much. So I was wondering a little bit about just integrative medicine and medical education. If you could speak to that a little bit.
Yeah, so I think that what we would love to do is kind of just share what our experiences have been. Certainly, as a faculty member, my experience with medical education several years ago was a lot different than I think what Tanya and Saloni have experienced. So I would love to just turn it over and kind of let them share kind of how they have experienced or had integrative medicine incorporated into their medical training thus far.
Yeah, absolutely. So I think when Tanya and I were thinking about this, we really think about it in two categories. One is the curriculum, and in that you have things that are mandatory, like lectures, and then things that are opt-in. And then we have extracurricular opportunities as well. So we kind of just wanted to talk about what we've seen at the David Geffen School of Medicine at UCLA. So when we look at the curriculum, ours is divided into blocks in the preclinical years. So we have 9 blocks, and then each block has an organ system or systems that we are learning. And some blocks have been really good about integrating integrative medicine into the curriculum, and others not so much. So, for example, block 3, which was a gastrointestinal medicine, endocrine medicine, and reproductive medicine, led by Dr. Mullur, who is here today. So that had a lot of information about mind body, and we were really appreciative of that. So for example, we had a lecture about the biology of stress. We had a lecture that talked about the mind gut connection and things like that. And so those were incorporated really well into our lectures by Dr. Mullur and Dr. Tillish, because they have lived experience of being integrative medicine physicians and talking about these kinds of things with their patients. And then they could, go on to teach us as well. So that was an example of, a block that was great. We also had block 4, which was the block after that, talking about musculoskeletal medicine. And in that block, we thought that there would be so much room to talk about integrative medicine, because we talked so much about pain management. And we found that very little, if anything, was mentioned in terms of integrative medicine, which we really think is a shame because, not only are there centuries of experience with pain management in like India and other ancient civilizations, but also a lot of these practices are evidence-based, and so they could have been, introduced into our curriculum. And that could have been something cool for us medical students to add to our toolbox to then help our patients with in terms of their musculoskeletal pain beyond just opioids and epidurals and things like that.
Yeah, that's a really good overview, Saloni. And as we were thinking about examples throughout our curriculum, like a great example is from that musculoskeletal block. So we learned that the first line intervention for any relatively minor musculoskeletal injury is the acronym PRICE, which stands for protection, rest, ice, compression, and elevation. And that came up time and time again. But if you take, for example, R, rest is just allowing the body time to heal itself. And integrative medicine is all about helping the body heal itself and partnering with the patient to make that happen, maybe through evidence-based mind-body modalities like yoga or meditation. A favorite integrative medicine physician of ours, Dr. Elizabeth Coe, recently shared at a talk that she often tells her patients, I can give you a medicine or I can coach you how to heal yourself, which I think is a beautiful example of how it can be incorporated here, especially when more than 1 in 3 Americans have already tried integrative medicine for their health problems. This is something we definitely view as a missed opportunity for teaching allopathic medical students how to give the best, well-rounded care for their patients.
Yeah, absolutely. So that's kind of on the like mandatory curricular front. We also have some opt-in electives at our school to learn about integrative medicine. So, for example, first years and second year med students can do the East-West Medicine Selective, which meets monthly for 2 months. And then fourth year students can do a 2-week elective rotation at the East-West Medicine Center. So these are, really great opportunities for us. But as you can see, they are relatively short, either 2 weeks or 2 months once a week.
Yeah.
I think that what you guys are highlighting is just how much interest there is at your level to have these approaches be brought in. And I'm so inspired by that, but because I think that certainly when I was training, this wasn't mentioned in medical school, and it really wasn't mentioned throughout my formal training. And it wasn't until well into me being a faculty member that I started to hear more people asking for these trainings, despite the fact that patients have been big proponents of integrative medicine for years. And so I think the fact that it's now coming from you guys looking for this training is really what's going to push forward this change.
Definitely, Dr. Muller, to your point, what was surprising to us is that within UCLA Health itself, we have so many integrative medicine resources and faculty. We have faculty at DGSOM, at the East-West Medicine Center, at the Integrative Center at the West Los Angeles VA, at the Mindful Awareness Research Center, and all of these programs and more are housed under the newly formed UCLA Health Integrative Medicine Collaborative. And so we find that there's definitely a mismatch between the resources we do have and then what we're actually exposed to in our mandatory curriculum. So what happens is that the majority of students right now who are seeking medical opportunities related to integrative medicine already had experiences before medical school. So we see even in our group DGSO and meditation that the majority of our participants have meditated before and they had an inherent interest in it coming in. So there's not that many students we find learning about integrative medicine for the first time in medical school.
Yes, absolutely. And so on the extracurricular side, we also have some resources available to us through school. So we have the Integrative Medicine Student Interest Group, which has, a variety of lunch talks and events where people can learn about integrative medicine from faculty that practice it. And we also had the Lifestyle Medicine Interest Group as well, which also has a ton of lunch talks and really amazing faculty. But like Tanya said, most people that are interested in these things are people who have been exposed to it before medical school. And, as busy medical students, we can tell you that there isn't a whole lot of time for us to explore things outside of what is mandatory. And so it's really a shame that, you have to almost have had that interest beforehand. And there's so much available to us through the UCLA Health Integrative Medicine Collaborative, but because of the lack of time that we have, a student can go through all 4 years of school here and really never be exposed to integrative medicine.
Yeah, we definitely find that our mandatory allopathic medicine training doesn't provide a good overview of integrative medicine, and it's really up to the student's prerogative to learn about these things. And there are a few times where integrative medicine is brought up by non-integrative medicine physicians. And when that does happen, it's often portrayed in more of a negative light or thought of as a last-ditch attempt at palliative care. So one example we were talking about is in one of our lectures, we had this slide on complementary treatments for vasomotor symptoms of menopause. And the slide mentioned treatments like ginseng, acupuncture, black cohosh. And the slide stated that the efficacy of these is similar to placebo. And they also stated that the placebo benefit is a quote, a 25 to 50% reduction in vasomotor symptoms, and that estrogen should be considered instead because it can reduce symptoms by up to 80 to 90%. So the takeaway of a student that's not inherently interested in integrative medicine would just be this complementary medicine stuff is just placebo, so we'll use something else. But why are we ignoring this choice that can reduce symptoms by up to 50%? Without the side effects seen with estrogen hormonal replacement therapy, which includes an increased risk of breast cancer and an increased risk of stroke. So what are we going to tell patients who are worried about these side effects and they want different options? And are we going to be trained well enough to give them all the options that are on the table? And I think the concerning answer right now is no.
Yeah, and I think that piece right there speaks so much to me. I've had the opportunity to teach with AIHM, and I've so appreciated that. And I've had the opportunity to teach at DGSOM. And I think one of the things that I try to make sure is mentioned is that we take a balanced view and a balanced approach to these choices that patients make. And for so many years, the rote answer for complementary alternative integrative approaches has been, well, there's no evidence for that. Well, there's no evidence for that. And certainly we've moved beyond that at this point, at least for most of the mind-body approaches and the level 1 approaches for pain, certainly. But still in the realm of herbal remedies and herbal medicine, we have so much we can learn. And I view myself still this many years after training as a scientist at heart and believe and understand and love the science of medicine. But certainly there are scientific bases for a lot of these treatments, and it's sure we can't cover every single herb, just like we can't cover every single drug. But I think having a more balanced view to kind of understand how these things might help, and learning about all of it, just like you learn about adverse effects from a pharmaceutical agent, you should be able to learn about the adverse effects from a natural approach. And so, I think that sort of balanced view, it is a challenge to get it in the curriculum. I know, as someone who has led your curriculum, it's really hard to find the time to put all of this information in. But I do think that it has been somewhat biased in that, we can't talk about it, so we'll just kind of put it off for now. And I hope that we can change that over time. And certainly we do have these nuanced conversations as you develop in training, right? So I have these nuanced conversations with my residents and my fellows, certainly. But I think even starting it earlier, so that it is there from day one of medical school, that we incorporate all of these ideas.
Yeah, absolutely, Dr. Muller. I agree. And I I think the balance is the key, and just giving students the opportunity to learn and explore it if they want to, I think would be amazing to have in the curriculum. And what Tanya was mentioning was that was just in one lecture, but then, you know, going off that same concept, we also found that concept reaffirmed when we had a practice test about the same question. So they asked, what is the best treatment for hot flash reduction? And the answer choices included hormonal things like estrogen, and then non-hormonal things like the black cohosh. And of course, the answer was estrogen. But in the description of the answer, they said that some natural products are more effective than placebo, and that wasn't something that was covered in lecture. That was something that a student would have to go into the question and read the answer and find. So we found that this was just something that was glazed over, and we weren't really given the opportunity to learn about it, Dr. Mullur, like you were saying. And when that type of thing happens, it signals the average allopathic medical student, it signals to them that this isn't something that isn't necessarily worth knowing or worth prescribing. And we're doing a complete disservice to our future patients by not knowing about it and by not having this tool in our toolbox, especially when so many patients are opting to go for integrative medicine services, more and more these days.
What's interesting to me is that when you look, you step back and you see some of the actual national policy changes that have happened in the last 4 or 5 years, when you have like the American College of Physicians clearly coming out with recommending non-pharmacological therapies as the first line treatment, including chiropractic and other approaches, and yet then that not getting filtered down to the education, where it's actually now the conventional medical bodies that are starting to put out these types of recommendations because the evidence is so clear and because of the work that's been done. And somehow that's still not getting translated, especially in institutions where, like you said, you've got a lot of integrative medicine within UCLA. Imagine some of the medical schools that have zero integrative medicine within their institutions. So I think this is just really reflective of how much work we have to do, and how we have to also be thinking about that policy aspect, that advocacy aspect of, getting all of the work that we're doing or collecting the evidence, the education, and then actually bringing it back into the institutions. It's such important work.
Absolutely, Tabby. I think you said it beautifully. I think from a curricular standpoint, a lot of us, DGSOM right now is going through curricular change. And so we are trying to add more and develop more, but the time is really what's limited, right? There's only so many, hours in the day. So I think that, coming up with kind of creative solutions around allowing deeper exploration for the students that are interested, and presenting it up front and not making it on the, making the onus on the student to go hunt for these opportunities, but presenting it up front so that for the students who are interested in more exploration, we have that opportunity there for them with the leaders that we have at our institution, and I hope that others will follow. The second point about assessment, I think, is also really key. As someone who is preparing for her students to have an exam next week, I know how important it is to make sure that what we teach is assessed, because otherwise it's just kind of one of those things that, oh yeah, this isn't going to be on the exam. And as much as we hope that our students don't have that view, it's still there. And so really getting that assessment piece to make sure that assessment of integrative approaches is presented in a balanced way, and not just always a bias against the harm of a treatment or the placebo effect of a treatment, but really to highlight some of the benefits, not just individually on an exam that I can control and write, but also on our larger exams. I mean, this affects, not just one specific block exam or shelf exam, but just all of medical training, making sure that we incorporate that, because this is what our patients are using every time. Right. every time NCCIH publishes their data on patient use of integrative medicine, we find it's increasing. And so we're leaving ourselves unable to really have these nuanced conversations with our patients if we're not prioritizing this part of their education.
It's such a disservice, right? And then it just forces everyone to go outside of the system and learn. Do you think that now that there is a national board exam for integrative medicine, that will help to shift the way that medical education is looked at, or the way that the systems kind of look at the subspecialty, the field of integrative medicine? Or do you think that that's still pretty far away from kind of trickling down into your systems?
I can say that I think we're closer. I do think we still have some work to do. I think what matters is, certainly having a board exam and having it be something that is, regulated with a qualifying fellowship and an exam certainly elevates the specialty. I think it also matters that the governing agencies all speak to each other, because some of these specialty boards are governed by different agencies than the standard training and governing agencies. So I think having those higher level conversations for those leadership organizations is important, and advocacy needs to be brought in there as well.
Yeah, that's a great point. So should we move to the next topic?
Yes.
And there are a lot of questions. So let's see if we can get through this one, and let's try and leave some time. So many good questions coming in. So just if you could speak a little bit around, cultural heritage and integrative medicine, the intersection of those two areas.
Yeah, I'm going to turn it over to Tanya and Saloni, but I just want to say that this is something that I think is so important, just as we talk about these integrative approaches, especially as the three of us are of Indian descent. So I'll let Tanya and Saloni start.
Yeah, thank you. So when we were thinking about this topic, I think a lot of what we want to say is centered around yoga specifically. So we were just going to talk a little bit about, our personal experience with yoga when we were first introduced to it. So I personally grew up with yoga just as like part of everyday life. My mom's mom, so my grandma, was very into yoga. She did her sun salutations every day. She taught Sanskrit. She knew all of the kind of theory behind yoga. And so that's how it was passed on to me through the generations. And I never really, thought twice about it. It was just like part of everyday life, like brushing your teeth. And then as I grew up, I started encountering people who were skeptical about it, like especially in high school, they didn't understand it. It was kind of portrayed as like the easy thing to do, like the easy sport. And I saw in media how it was ridiculed a lot as well. And so I started seeing kind of that side of it, and I didn't really understand it. I felt like yoga had been taught to me, and I had this like very unique gift that was passed to me throughout my culture, and I understood the principles behind it. And so a lot of what I have been trying to do is teach people what I know about it, and hope that they're open-minded enough to try it, because I think that once a lot of people try it, they really open up to it. And so that's kind of been my experience with yoga.
Yeah, when we were all talking about our first exposure to yoga or something that falls within integrative medicine, we all mentioned the elders in our family, which I think is pretty special. And, for me, it was also from my grandmother, where I was first exposed to yoga, and she would do her asanas every morning, and I would watch sometimes with curiosity. But what was interesting is that I did notice a difference in attitudes towards yoga from my grandparents' generation to my parents' generation in India. And at least according to my parents, who I think are watching this right now, they said that yoga was something that was very traditional and therefore left to the elders to do. And in other words, it wasn't really cool. And so I think a lot of people would agree that a lot of India looks to the West for its consumption of what's cool. And as the yoga industry started to boom in the West in the 80s with fancy yoga pants and mats and designer classes, it started to become more cool. And that was when yoga, which is this tradition, it's a lifestyle that's thousands of years old and originated in India, caught on with the youngest generation in modern day and really took a life of its own. But that's at least how my parents tell it. And it's been really interesting to watch as a person caught between both of these cultures, Indian and American.
Yeah, I have a similar story. Certainly exposed to yoga as a younger child and practiced Indian classical dance, which is very yoga based as well. And what's interesting to me is, I had all of this kind of knowledge, and when I went through my own training several years ago, I was exposed to kind of Western yoga with the classic studios, and then, really started to kind of see how yoga, even in medicine, is kind of separated from that cultural heritage. And I understand kind of how that is, but it's interesting because when I think about the core of yoga, it's really about that connection, mind, body, spirit, which is integral to what we talk about in integrative medicine. But somehow when we translate that, not only in yoga as it's consumed outside of integrative medicine as more of a sport or wellness activity, but also in medicine, we talk about it in terms of, improving outcomes or things like that. And it has to be always evidence driven. And I appreciate that, but certainly we're not all bots, right? We're all people that are taking this ancient practice to find a way to heal ourselves. And so I think returning to that cultural heritage has been so important for me.
Yeah, absolutely. I think you hit the nail on the head, Dr. Muller. I think it's about honoring the tradition where it came from. Like if we think back to when yoga started in the 7th century BC, traditionally back then, little boys like 8 years old would leave their home, leave everything behind, and go stay with the teacher who would teach them, kind of these everyday practices like meditation and yoga. And that was the tradition. And when you think about that, they had to sacrifice so much in order to learn yoga, which, necessarily isn't the case today. And, then there was really no expectation from it. It was just kind of like your everyday life. You just learn it and you just do it. It's like part of your duty. Versus now, I think a lot of times yoga is used as like a quick fix. And you're expecting something from that. And that leaves room for disappointment, if you think you're going to get something out of it in just a few sessions. And so I think, now we might be losing sight of that original purpose that, we had so many years ago, which was really, like you said, Dr. Muller, to tap into your prana or your subtle life force energy, or chi, as some cultures call it. Um, and, now I think a lot of the motivations for yoga have been shifting. So, for example, like one thing is yoga has almost become kind of like a sport these days. So, where people are, trying to achieve something or trying to compete, not necessarily with others, but sometimes with yourself. Like, I really want to achieve this flexibility, or if only I could do that pose. So, a lot of it has become like a sport where you are expecting something at the end. And then, of course, a lot of it has become monetized, which, we understand like people are trying to make a living out of this, but it's really about where are your priorities? Is your priority really to teach, the learnings from this ancient culture, or is it solely just to make money and, be cool, like Tanya was saying, or be hip? Um, and so definitely I think yoga is not prescribed enough, but when it is, oftentimes it is used as like a quick fix. Like if someone has back pain, they be sent to like an in-hospital yoga class, which of course we hope that will help them. But I think originally yoga was prescribed more not prescribed, but used more as a preventive thing that you use from like a young age, and you'll see those benefits over time instead of over just, a few weeks. And so I think we all consider ourselves really lucky to be bicultural and get to, be in this country and learn allopathic medicine, but also have this cultural background where we've learned kind of the background and the backstory when it comes to yoga.
Yeah.
Wonderful. So maybe we could take some questions.
Sure.
Would that be good?
Yeah, that'd be great.
So these will go back to your first presentation on the program. Let's see here. Can you share on the chat just how to sign up or look for more info about it? Some are asking about what type of meditation was practiced in the study. Was there a specific one, or was it just generally that people could do meditation? Did you?
Yeah, so in terms of getting more information, so this is something, it wasn't really meant as a study. It was more something that we created just for fun. And then we saw that it had kind of a great response. So in terms of getting more information, you can definitely reach out to us. This isn't like, formally written up anywhere. And we're happy to share our emails. And we've actually already helped another medical school create a similar program for themselves. So we're really happy to continue to do that. And then the second part of that, what was the second part of that again?
Yes, just is there a way to find out the details of what meditations you used for your program?
Yeah, so for that, we wanted to keep it really, really flexible. So we told people you can do any kind of meditation. It doesn't really matter. We even said, if you want to do something like mindful eating, where you're not necessarily closing your eyes, but you're just having your meal and being present, that kind of thing would count too.
That's great. And again, someone would like detailed instructions on how to implement this. Just a lot of excitement about, the success of this, and really wanting to understand how this can get out to other institutions, other medical schools. So it sounds like it wasn't necessarily a controlled study. This was a question, how did you set up the control population? But it was not really set up like that. Is that correct?
Yeah, it was set up as a community of practice.
Yeah.
Yeah.
Great. Could you please say a few words about the East-West Center, including its purposes, goals, and outcomes?
Oh, I'll answer that. I don't want to speak for Dr. Hui because I know he's spent years developing this amazing center. So really, Dr. Kaka Hui, one of the legends in integrative medicine, set out the East-West Center, I think now more than 25 years ago, and really pioneered the use of traditional Chinese medicine in an allopathic setting. And so it has a training program for trainees to learn about acupuncture and traditional Chinese medicine, and has been a real value for UCLA to learn about these approaches. So they have a website that maybe I can try to throw in the chat box.
Yeah, that would be great. That would be great. And then another question just around what the global health equity pathway at the David Geffen School of Medicine is. There's curiosity around that.
Yeah, I would love to share. So so we actually only have one pathway at the David Geffen School of Medicine, and it is the Global Health Equity Pathway. So it's for students who are interested in global health in any capacity. And so through that, we have a lot of different lunch talks from faculty who do global health work. We have opportunities for mentorship from them. Over the summer, we can do a global short-term training program where we do a research project in another country. And then during our fourth year of school, we can do a clinical elective in another country, such as India as well. So really, it's just a pathway for learning more about career opportunities in global health and getting research mentorship.
Great. Another question, and this is really for you, Tanya. Could you elaborate any changes that were noted on fMRI studies when you were on yoga and meditation, the research done at Mass General?
Sure, it's really exciting research. I worked with Dr. Sarah Lazar, so I really encourage you to look up her name and look at her work. But she was one of the first people to show with structural imaging that meditation causes changes beyond the placebo effect, which was a huge deal in communicating with people who were very dismissive of the efficacy of the practice. And so she's moved to using fMRI as well. And we have seen changes in participants who do an 8-week intensive course, like people who have never meditated before, and they go through an 8-week intensive course in places like the hippocampus and the amygdala and the insula and the prefrontal cortex as well. So there's a lot to be said about this. So I really encourage looking up Dr. Sarah Lazar's work.
Great. Maybe you can put her name or his name in the chat. That would be great. And this is another question, just great follow-up to that. Do any of you feel that there's a subtle dismissive attitude towards integrative medicine still among other faculty? How has having open-minded faculty impacted your worldview personally?
Yeah, certainly, I still find that there has been a little bit of a bias. I feel like I've been teaching now for several years, and I finally now feel like there are faculty welcoming of these ideas. But I think for several years there was a bias against it, and we still see this sometimes, even sometimes on Twitter, you'll see people talking negatively about integrative approaches, and it's surprising to me. I mean, I certainly don't think anything is perfect. There's no perfect medicine. I really do think it needs to be individualized to the patient, and I think that's where I found that integrative medicine has offered me that approach in ways that allopathic approaches have not. That being said, I think that it is shifting. I think having our UCLA Integrative Collaborative has been so nice because, we got together a few years ago, and for the first several meetings, we just shared what each of us was working on. And I think all of us just had eyes, opened and excited because we didn't know that we were all doing these things in our silos. And so now to have that collaborative experience and to be able to share that and to then be able to share that with the students has been really my goal. I'll open it up to Tanya and Saloni to see if they have anything else they want to add there.
I think it really makes a difference. I have been with physicians at the school here as tutors for small group discussions who really make it clear whether or not they're in support of these practices, and it can be difficult sometimes when like that atmosphere is created to continue the discussion or just bring up points on different ways we can help the patient with whatever symptoms that they're presenting with. And so I think my peers in general are very open-minded. So I've definitely brought up points like, oh, this and this modality is evidence-based. Why don't we think about this? And have been supported by my peers, even if the physician mentor is a little bit dismissive of it. So I think when we are in the presence of someone who is very attuned to this work, it just makes the discussion flow a lot easier. What do you think, Saloni?
Yeah, I mean, I second everything you've said. I've definitely had people that like faculty members in small groups that just put it down, like, oh, they took that, let's just skip that, or oh, that there's no evidence against that, we should not be recommending that. But I think sorry for the dog barking. So I think we have when you're really interested in this, like Tanya and I think it's such a breath of fresh air when we get, faculty like Dr. Mullur talk about it in lectures. And I think it really helps with this burnout that we might be experiencing when you get to learn about these things that you're very interested in. And so I think that, just having more opportunities like that in med school would be amazing.
I think this is also very aligned with what actually happens in the system. So just as a patient, like in a conventional system through insurance, if you go, through, like I go to Kaiser, and I can ask a pediatrician, a physician, and immediately what camp they're in, like whether then I can share or not, really depends on how that initial reaction goes. And so I feel like, just when you bring this down to the patient level, it's just like you're dealing with just managing that with faculty and the docs that are teaching you. But then when you actually get into the patient dynamic, it's very similar, right? Patients are trying to test the waters of how much does this person sitting in front of me, might they accept me or judge me, and then trying to figure out what they're going to share. And again, if we go back to what's happening in the bigger population, like people are absolutely accessing integrative health. Whether they're sharing that with their conventional providers is still just a huge obstacle to, really getting good care. So I just think this is just a great reflection of how we see, the culture is shifting, right? It is shifting, but we still have a lot of work to do.
Yeah,
absolutely. Thank you for being pioneers in this. It's really just very inspiring.
Well, thank you, Tabby. I think I have found so much camaraderie and support from AIHM as well in the advocacy that you guys are doing to push these forward. And so I really appreciate that. I think just as our patients have pushed forward the changes we're seeing in terms of guidelines coming from American College of Physicians, et cetera, I think it's going to be our students that push forward the change so that the organizing bodies that govern medical education will start to incorporate more of this. Because I've had the pleasure of educating several faculty members and fellows in integrative medicine over the years, but they've been looking for this training from when they started in day one. And so, having a group of students really push for this and move this forward, I think is what's needed. And so I'm so honored that Tanya and Saloni have been leading the efforts at DGSOM, and I'm excited to hear about what's going on at other medical schools. I think if we put ourselves together and really start advocating, we can make some real changes happen.
Well, and that's a great, just kind of segue into part of our mission at the Academy is to really bring all of us together to work on these issues together. And, we're right now developing a kind of a special interest group model where we would really be able to better connect students and through our chapters and student alliances. Our goal is to really start connecting you all with each other so you can also share how you're doing this in different institutions and how you're approaching this in different places, because again, then we learn from each other and we can really try and push change at a much different level. So a couple more questions, and we have so many questions in here. We won't be able to get to them all, but I'm just going to read a couple more. One doc says, at Morehouse School of Medicine in Atlanta, we have initiated to include Siddha medicine practice for our medical students in a fourth-year elective for them to do in Chennai, India. This is through our Global Health Equity Program to implement integrative medicine. If interested, we'd like to initiate collaborative approaches with the group at UCLA. So again, just a beautiful, connection, and also an AIHM member there. And so finally, here's just a comment from Marilyn Gerber. I'm an international integrative engineer and nurse. In 2009, at the 20th anniversary of NCCAM, I asked several nurses if they would make a mandatory curriculum to teach nurses to choose either homeopathy, acupuncture, and integrative medicine as their nursing specialty. I offered to give $20 million to do this through the deans of all of the nursing colleges in the US, and they all refused. This is a Swiss US citizen who trained all over the world, India, China, Europe. Just to think 20 years later, the number of nurses and MDs that are actually now starting to do this. So, again, we just start to see this culture shift, and it's so important that we're all out there doing this work. And I just really want to thank you, Tanya and Saloni, because you are the future, right? You are the future of what our medical system is becoming and will look like. And just so really thrilled to see all the work you're doing and the successes that you're having.
And we want to thank you, Tabby, and all of AIHM for giving us the opportunity to do this and creating the community. When we attended the conference last October, even though it was via Zoom, I was telling both Saloni and Dr. Muller, like, what a breath of fresh air that was. I was like so bogged down with studying, and I just felt so invigorated that weekend, thanks to everyone in this community doing this work. So we're very appreciative.
Well, thank you. Thank you all so much. And we're just going to wrap up next week. We want to just thank you for joining us today. We'll be having our monthly meditation Monday, and our very dear Dr. Sandra Amato will be leading us off in that meditation. It's just really wonderful. If you want to join us at 8:30 a.m. Pacific time, it's short, but it's a wonderful way to start your week. And then next Friday, March 5th at 12 p.m. Pacific time, we'll be meeting with one of the icons of integrative health and medicine and this movement in the United States, the best of John Weeks, an interview with an integrative health visionary. So for those of you who don't know John Weeks, I mean, he has just done so much to really move forward all of this work in integrative health, in naturopathic medicine, and across all of the different professions. Truly amazing story. So I invite you to join us for that interview with him. And then I really am so proud of this event that we've put on. Our board of directors really wanted to bring lots of different leaders in the integrative health space to really talk about COVID. And we're putting on a virtual conference on March 24th to the 27th called Hope, Resilience, and Healing in the COVID-19 Era, Practical Tools for Integrative Clinicians, What We Have Learned in the Last Year. And this is an international group that's coming together. We're partnering with the International Federation of Anthroposophic Medicine. We'll have speakers from Russia, Brazil, Europe, and then of course the United States. It is a CME event, and for our members, it is $50. For student members, it's $25. And if you are a frontline worker or in an underserved community or serving underserved communities, you can apply for a scholarship and come for free. We really want to begin a real dialogue around how we can give back as an integrative health movement to the pandemic and all that's going on. So really great talks. I highly recommend coming. We have some an Indigenous panel too from Indigenous leaders in the United States and some of the work that they are doing at a grassroots level. So it's going to be a really phenomenal event. So please join us. Rashmi Mullur will also be presenting at that conference coming up in March. So please stay connected with us at the Academy. Join our YouTube, subscribe to our YouTube channel, and then you'll just get the recordings of our weekly sessions if you're not able to come live. Please consider joining the integrative health community and becoming a member with AIHM. It's really reasonable, and we're all connecting each other to make this change and transform our healthcare system. So thank you again. Tanya, Saloni, Rashmi, what a pleasure to have all three of you, amazing women leaders, on our webinar today.
Thanks.
Thank you.
Have a great weekend.
Thank you.